Despite Western coercive measures and severe damage to health facilities terrorist war has caused, Syria has shown remarkable progress in the recovery of its health sector during the current year. The expansion and the opening of hospitals, health centers, and pharmaceutical plants is proof of that. Let's see.
Syrian health authorities offer free medical care to all the country's citizens without exception. The blockade causes limitations. However, they continue to do so in the many rehabilitated and rebuilt health facilities with the resources and with the support of friendly countries. One example of that is the opening of the Harasta hospital in Damascus countryside this year. It has 90 beds and the setting of the first stem cell transplant center in the country.
Despite the difficult circumstances of war and blockade that prevent us from importing the necessary medicines, equipment, and medical supplies, we have managed to build an equipped center and other health centers in the country. So we can consider this achievement as a resilient answer.
In parallel, 4 national vaccination campaigns against COVID-19 and numerous immunization days against cholera, polio, and other contagious diseases took place in 2022. Syrian authorities have had to face a lack of medicines, equipment, and medical supplies due to the blockade. They have not been alone, however, since they have received medical assistance from Russia, China, Cuba, and other friendly countries. They have also reactivated the national pharmaceutical plans, which this year covered 90% of a country's medical needs.
The sanctions affect all sectors, the health sector included. Due to the blockade, we are facing great difficulties in securing the necessary resources to fight coronavirus. That is why we demand the immediate elimination of this humane blockade, so that we can fulfill our mission in confronting coronavirus and other diseases. The pandemic also affects young people. That is why I came to get immunized, since I consider that all the youth must get the vaccine because they are the most productive sector and their health and work are both essential for the development of the country.
Thousands of civilians and military personnel, crippled as a result of the terrorist war imposed on Syria, were able to recover their physical and kinetic abilities thanks to the free medical and physiological care they received at state-owned and civil society prosthetic centers. Meanwhile, the national campaign for the early detection of breast, cervical, and prostate cancers continue in the country. Despite the difficult war and blockade situations, the Syrian authorities promise to continue this work in 2023 to guarantee public health.
Hisham Wannous, teleSUR, Damascus, Syria.